Thank you all for coming today. We really appreciate the opportunity to provide an update from the City of Duluth and our partners. If you are watching, we know that there's been an additional add-in by the President, so again, appreciate all of you taking the time today to hear really important messages and updates not only from the City of Duluth, the county, our medical partners, and additional community members in our community. So thank you, and I'd like to introduce Mayor Larson.
Thank you, Kate, and thank you to our city staff who literally have been working around the clock in support of this community to both communicate but be really proactive and help our residents, our businesses, our healthcare facilities, everyone find a new norm and a new way to work through things. I am going to just relay a few items, and we are in this room really specifically because we are working hard to contain COVID-19 as much as every other organization. So many of you know that we have closed public facilities, so we are just in the rotunda for this very short period of time so that we can relay information to all of you. And we have asked our speakers, we're kind of scattered around this room here, at the appropriate social distance so that we can practice containment strategies and model that for ourselves and others. Yesterday, well, I guess it's only Thursday, isn't it? So Tuesday, I signed an emergency declaration for the City of Duluth that will go before City Council at today's meeting. There is a resolution that will go forward. The intent of that is to build upon the emergency declarations that had been signed and passed by Governor Tim Walz and by President Trump. Our emergency declaration, we feel, gives us the ability to continue to be flexible but very focused on how we can be nimble at this time. For instance, it will allow our City Council to continue to meet today while the building is closed to the public. They will meet. A few of the members will be phoning in to just allow for containment purposes, and we will be practicing social distancing there as well. So it allows us to do that, to continue to function, and if you go in and look at the council agenda, there is a ton of regular business happening that we need to continue to be very, very focused on. So while many of us are experiencing this pandemic and working through the details of that, we also have hundreds of people here in the city, City of Duluth, who are working on their everyday operations of the city. So CAO Shuckman will represent the administration at the City Council meeting. I will not be there tonight. He and Attorney Hankey are certainly well enough versed to work our team through that. I have a couple of announcements I want to make to all of you. First of all, we have added a COVID-19 page to our city website. If you go to duluthmn.gov, you can click on the red banner, and that will take you to a page that has local resources and information on it. We are collecting a lot of resource information, as I know all of you are. We are trying to make it as easy as possible for our residents to get the information that they need. You can find a lot of information there. We are updating it daily with frequently asked questions, both local and state resources as they are created. So please check on that page often. I have an announcement as it relates to sales taxes and taxes that are due to be remitted tomorrow for February sales, hotel, motel, tourism tax, and other tax collections owed to the City of Duluth. We are extending the date by which those can be paid. They are due tomorrow for February. However, we have chosen to give a little grace time during this period of intense stress for our businesses. I need to assure you that we are not erasing those payments. Those are the payments that we will need to continue to provide the services that you need now, and all of the many services that will continue us into the future, not just through this pandemic, but through the long haul of all of the projects we have going on. So we will put out a press release shortly about that. We will update our website. Anyone who has questions, please feel free to call. We are receiving tax payments very regularly. Many people have already paid those. Thank you for that. Again, they will be due on April 20th, but we do want to recognize and give you some flexibility to be able to do that in a different way or provide a little more time for you to do that. Secondly, or maybe third or fourth, I don't know, kind of losing count, but our librarians are hard at work, working and planning for the next few weeks. Our buildings are closed right now, but I'm really excited to announce that next week the City of Duluth will be hosting story times, and we're going to have different people reading books. I will be reading a book, fire chief, police chief, and a few other special guests. So we are in the process of selecting books to read. We are creating a schedule. We are working with publishers to have permission to read those books and share those with kids. So again, connecting with you is really important, and we know these resources make a difference in your family life and in your home life. So stay tuned for that. We will press out information. You will find Storytime live on the library's Facebook page, so families can watch together, and because it's a public page, you don't need to have access to Facebook. You don't need to have an account to do that. And then lastly, before we move on, again, there's a series of speakers here. Thank you to the community leaders who are working so hard in support of this community. We are asking all of our speakers to be as brief as possible, and yet it's so important that you get all the information you need in ways that are accessible for you. But we are on day 3, the City of Duluth, of being home, of having workers be home and buildings closed. And with that said, I just want to say it has been amazing and incredible to see the outpouring of love and support in this community and what we are showing one another. From businesses giving away free hand sanitizer, to neighbors delivering eggs or fresh bread to one another, people calling to connect, people buying gift cards from local businesses that really need us to show up for them right now, and then sharing those gift cards with essential workers, sending letters to homebound seniors or senior citizen buildings that are closed so that we can stay connected to each other. This is the Duluth that we know. This is the Duluth that we love. We need to keep it going. There is joy in every single day. Sometimes we need to find it, sometimes we need to create it, but every day we get to be that joy for somebody else. So with that, we're going to go through our list of speakers, and we will start with Congressman Pete Stauber. Speakers, just come up. When the person before you is done, just come on up and introduce yourself. Thank you. Congressman?
Thank you, Mayor. Just a first quick briefing. Last night, the President signed the second COVID-19 relief bill. This was the family's first Coronavirus Response Act. And what it did, it provides the free testing to Americans, provides paid sick leave, and it protects seniors with severe medical conditions. And it expands telehealth services where Medicare will pay for that telehealth services. There are ongoing discussions about a third COVID-19 relief bill and what it may include. And my office is working hard. The third round is going to look more closely at our small businesses and how we can help them, how we can allow them immediate access to capital so they can meet their current obligations. And we're in that in those negotiations and talks right now. As you all know, the President invoked the Defense Production Act. This allows private companies to work on certain things needed for our communities, like personal protective equipment, ventilators, etc. And so I think that, as I've stated before, the full force of the federal government is in force, working to protect American people, to make sure that we are all safe and healthy, in particular our vulnerable seniors. Small businesses are the backbone of this economy, and as a member of the Small Business Committee, I remain focused on identifying ways in which we can assist them. And we all have the opportunity to do that, from the federal government, from the state government, from our local government, including our cities and counties. And I want to encourage everybody, as the mayor just said, let's try and make sure that we take care of our small business men and women by ordering food if they have takeout, buying gift cards if they offer them, and also to have the ability to order online locally if they have that in place. It's incredibly important that we all take our part in social distancing. That's one of the biggest ways we can flatten that curve, because we do not, as stated earlier, we do not want to inundate our medical facilities or medical personnel, and that responsibility is incumbent upon each and every one of us. No one is the exception. Let's all follow those recommendations from the CDC and other medical professions. Good hygiene, keep your hands away from your nose, mouth, ears, and eyes. And I want to conclude by thanking our healthcare workers, our first responders, our firefighters, and our law enforcement community for being on the front lines during these times and helping out. And I want a quick reminder to everybody that our staff remains committed and open for questions. And if you have any questions, please call 218-481-6396 or 202-225-6211. We know as a nation, when we come together, we can solve anything. And I have full confidence in the American people, our local states and communities, and our leadership that we too will get through this together, and we will have our after-action reports when it's over with. We'll do what we do. We'll know what we did good. We will know what we can do better. But for the time being, let's work together as a nation. We all live in the greatest country on earth that we get to call home. Thank you.
Good morning, I'm Shawn, Fire Chief and City of Duluth Emergency Manager. I want to just reiterate that as we've been doing all week and for the last few weeks, we're working very diligently with our community partners, whether that's St. Louis County, the Minnesota Department of Health, State Homeland Security, and others across the region and the state. I want to remind people that as much as we hear about this as a public health issue, which it of course is, it's really a community emergency that affects schools, the business communities, vulnerable populations, not just here in Duluth, but region-wide, our first responders that are protecting the community. Please think about things as you're calling for help. Do you really need us? Is it really an emergency? Are you just uncomfortable, or do you need a response from law enforcement, from fire, from an ambulance crew? Please follow the recommendations that you're getting from the hospitals or from your doctor or the clinics. Sometimes the best thing you can do is just wait at home, kind of let it run its course, see how things are going. When you call 911 and you just because maybe you just don't like the answer you got the last time, that's really starting to drain all of our resources throughout the region. It's not that we won't come, but we really need the community to think about that and just consider the people who really are in need and do need an emergency response. We continue to follow CDC recommendations, the recommendations of the Department of Health and our local medical control on how we respond to these emergencies as first responders, as firefighters going in to medicals. We're continuing to follow the PPE guidelines that we've talked about all week. Nothing has changed there. So again, you may see firefighters in a mask, in goggles, in a gown, of course with gloves. Again, don't be concerned, but we do have to take those precautions for both our safety and for yours. We continue to work with St. Louis County Dispatch on the questions that they're asking you. We're trying to get the best information possible. Please be honest. If you do call 911, let them know what's going on. Let them know what your symptoms are. Don't over-exaggerate your symptoms, but also tell them what they ask, what they need to know. It's vital for us as we're coming in to prioritize calls. We're starting to get into some levels, not so much here in Duluth, but in some other areas where they're starting to tier calls as what we would call a code 3 or a tier 1 call versus a code 2 or a tier 2 call. And we really want to get the right resources there as quickly as we can. We continue to track the needs of our people experiencing homelessness in other vulnerable communities. Our Human Rights Officer, Carl Crawford, is working with all sorts of partners to make sure that those needs are heard and those needs are brought up to the proper, whether that's city leadership, county leadership, Department of Health. We've got a lot of people who really don't have anywhere else to turn, and we are working hard to meet those needs and make sure that people in that community and in those sometimes special groups know that we do have their backs and we are advocating for them as well. We're working with Lee Stewart and our partners like Shawn and the county to look at what we can do and how we need to expand resources for everyone in our community.
Hello, my name is Elena Foshay. I'm the Director of Workforce Development for the City of Duluth. We understand that this is a really difficult time for workers and employers. The City of Duluth's Workforce Development Department is acting fast to adjust our services to current needs following state and federal guidance. To maintain the health and safety of clients and staff, Duluth Workforce Development staff are working from home and eliminating in-person appointments. However, we're monitoring email and phone messages daily and reaching out to our clients. Staff from other agencies housed within CareerForce have also moved away from in-person appointments, and many will be working from home. However, CareerForce remains open at this time with some changes to our services. So in-person workshops are canceled. We're exploring a virtual option to help people with job search assistance and resumes and interviews. We'll announce that as soon as it's ready. Our Career Lab computers are available for unemployment insurance applications, job search, job applications, resume writing, and other employment-related uses. Use of the Career Lab will be limited to 5 people at a time, and we've made some other changes to the layout just to help support physical distancing and make sure that we can protect the health and safety of visitors and still provide assistance. Our phone lines are open. We've added extra staff to answer phones, and we'll answer as soon as possible. So if you have questions, you can call your CareerForce employment counselor, or you can call our front desk at 218-302-8400. Workers who've been laid off or experienced a significant change to their employment due to the coronavirus are encouraged to apply online for unemployment. There's expanded eligibility, and we've changed, or the state has changed, some of the rules to try to get people access to benefits as quickly as possible. The website to apply for unemployment is www.uimn.org. Employers have a lot of questions right now about what happens for them, what supports are available for them. That's changing every day. Employers can find more information on DEED's website, and Duluth Workforce Development has also put together a resource guide for employers that we're updating daily. It's posted on the city website. There's many supports out there for both employers and workers right now. There's more coming. We'll keep our page on the Workforce Development page on the City of Duluth website up to date, and we'll also post updates on the Duluth Workforce Development Facebook page, so you can follow us there. Thank you.
Good morning. My name is Fleege. I'm the Director of Planning and Economic Development for the City of Duluth. And part of my responsibilities include building inspection, construction services. As Mayor Larson and Director Foshay mentioned, we continue to hear how the COVID-19 is affecting businesses and individuals in the Northland. I wanted to give an update on my department and what my department is doing to ensure that businesses continue to have the services that they need as they're preparing to start projects, construction projects, and as they're trying to get their necessary permits. Our department is open. We're basically processing all those online. We used to process about half of our applications through a web-based interface. We're encouraging businesses to leverage that tool. We've got folks working remotely, and they're taking calls and responding back to applicants with questions. We're setting up web conferences with folks as we're going through. So the message is really that if you've got a project, a renovation, a rehabilitation that you're doing, that our team is available and here to serve you. So we want people to continue to know that even though the city offices may be closed, you have access to our team, and our team's very engaged. Like all departments at the city, our team is working to continue serving businesses and individuals during this difficult time. We may not be in the office physically, but our folks are diligently working to respond and support construction projects within our community. So we wanted to assure you of that and let you know that we're here to serve. Thanks.
Hello, and thanks for being here today. Kevin Gray, St. Louis County Administrator. And first I want to thank Mayor Larson and her team for continuing to host these conferences that helps to get the messages out to our residents and even to our employees who are now many working from home. This is an important service, so thank you, Mayor Larson, for that. I've got a few updates from a county perspective, and I'll try to go through them very quickly and turn the floor over to Amy Westbrook, our Public Health Division Director, who has the broader messaging around our public health responses. County buildings are closed today and tomorrow. This is going to afford us a chance to do longer-term planning and see what the new norm, to borrow Mayor Larson's phrase, will be for county in terms of services and walk-up services, if any. We expect to announce an updated schedule tomorrow afternoon. A couple of notable exceptions to county building closings. Courthouses remain open to support court operations. There's been some confusion around that, and I want to reiterate that the courthouses in in Hibbing, Virginia, and here in Duluth remain open to support court operations. Also for northern St. Louis County residents, just a heads up that our county landfill and transfer stations and solid waste drop-off sites remain open. We need to continue those services. As has been reported on Tuesday, the county board held an emergency meeting and unanimously approved declaring a state of local emergency. Like the city and like other cities and counties throughout the state, this affords more flexibility to administrative staff in support of the commissioners and our elected officials, so we can react as quickly as possible to the rapidly changing situation that is the coronavirus. The challenge is particularly unique and tricky for those of us at the county in terms of what services and how we provide services to the public. Most of our, if not all of our services, are mandated by the state and local federal governments. So that puts us in a position of complying with statutory direction and trying to balance, of course, how we deliver those services in a safe manner, both for our residents and our employees. So we can't just close down unilaterally. We're going to continue to provide services that arguably are more in need for many of our vulnerable residents and those in legal and other scenarios that are needed now more than ever. So we are working hard to promote a continuity of services model, but of course prioritizing the health and safety of our employees and the public. Just to give a heads up on steps that we're taking from an employee standpoint, we recognize that different departments have different needs and capabilities. So we're giving department heads and going through aggressive planning efforts, giving department heads broad latitude to implement maximization of flexible scheduling, weekends, evenings, to promote social distancing, to promote the ability of our employees to provide family care and well care. We are greatly enhancing and being much more flexible with the use of mobile working. We anticipate over the next several days to have quite a number of our people being able to work from home while still providing needed services and supporting the operations of the county. We are encouraging people who have underlying symptoms or issues at home to make use of the paid time off that's available to them, and being very flexible and understanding that we need to support people's decisions on that front. So we'll continue on the mobile working front in particular to try and maximize people working from home and distancing, if you will, but also recognize that we need to have on-site presence as well. So just as a reminder in that vein, we also are encouraging the public to please be aware that we're providing services by phone, email, online. We're working hard to update our website. We're adding things today with links to various public health and clinic links that we think will benefit people that are looking for answers around the virus. But with respect to county operations, we are very aggressively working to make the website be a portal point in addition to email and phone calls. Finally, I would just conclude with we recognize these are challenging times, uncharted waters, definitely. We're very committed as a team, very supported by our commissioners. We're going to be working hard to be flexible and continue to update the public and our employees as we make decisions and strategic plans around the best way to deliver services and protect the health and well-being of our citizens and our workers. Thank you for your time and the vital role the media does in messaging for so many people. We appreciate it.
Good morning. I'm Amy Westbrook with St. Louis County Public Health and Human Services, the Public Health Division Director. I want to thank Mayor Larson again for having these press briefings. I think it's really important to get as much messaging out as we can. Things are changing daily, and as the fire chief mentioned, this is challenging times for all of us. All aspects of our community are really being affected. This is representative of how broadly we have so many aspects of our community viabilities represented here. So these are really challenging times and scary times for some people. So please know that we have a lot of community partners coming together in planning and response for this. It's a big community effort to assure that we're doing what's right in public health, but right also in maintaining our communities and keeping them going. So we're always reevaluating our public health recommendations. We base them on science and current resources. So they do change, but we recognize that it's a very rapidly changing situation. So please keep updated through the Minnesota Department of Health, the CDC, the Centers for Disease Control and Prevention. We have those links to their information listed on our website, as the city does. Right now, we know that across the state for our MDH diagnostic lab, or the public health lab, testing is limited. So we have limited testing recommendations to healthcare workers, individuals who are living in group congregate care settings, and hospitalized individuals. So we ask that if you are experiencing respiratory symptoms that you can manage at home, that you please stay home. Stay home for 7 days or 72 hours after your fever resolves. And self-isolate. Individuals who are contacts of those people who are experiencing respiratory symptoms, please practice good social distancing, limit your outside time or interactions with people for 14 days. So these are changing recommendations in terms of impacted by the capacity that we have for testing. But for everybody, we are certainly recommending continuing to wash your hands, practicing good social distancing, keeping resources on hand if you do need to stay home and isolate yourselves, using alcohol-based hand sanitizer. And we're doing all of these activities as a community to make sure that we're protecting our most vulnerable individuals, our individuals who are most at risk for complications, older individuals, and people with immunocompromised immune systems, and to protect us all. We do see severe illness in healthy individuals too. Most of us will be able to fight off this coronavirus, but many of us will also, especially those who are most vulnerable, could have more severe illness. Let's see, as a community, we're recommending that events of any size should be continued only if social distancing can be implemented and proper hand hygiene can be supported. We are, as a public health system, offering guidance and decision making when organizations, groups, county, government entities, schools are going through these decision-making processes of, what sort of services are still offered, how do we, what sort of best decisions should we make with public health recommendations. We're available to consult on these decisions, and we're also available for providing good public health education based in science. We continue to ask people to change their behavior and do all of these good, healthy behaviors that will help protect individuals as well as all of us in our community, and to maintain those behaviors. So we keep saying, Governor Walz said yesterday, it's not a blizzard but a winter, and so it is going to take some maintained behavior change for all of us to make sure that we're protecting each other, our communities, our neighbors. As of yesterday, we have 77 confirmed cases in Minnesota, still none in St. Louis County, which is a good thing. But with limited testing, we want to be vigilant about our respiratory illnesses. So please follow those guidelines about staying home, social distancing if you're having if you're experiencing respiratory illnesses. And I have been really, really proud of how we've come together as communities in Duluth and across St. Louis County to work together to do what we can in implementing good public health practice. So thank you.
Good morning, I'm Bill Gronseth, Superintendent of Duluth Public Schools. I have to begin this morning with a shout out to the ISD 709 staff who have been hard at work making sure that our families and students have the support that they need. Thanks to their quick efforts, we were able to have childcare and breakfast and lunch service in place starting yesterday. Breakfast and lunch is available at all of our sites. We're serving it out of our school buses. There are also several hubs throughout the community that the buses will be serving breakfast and lunch. We're providing those at the same time. People can check our website at isd709.org/updates for all of the hub sites for that delivery. In addition, students who receive special education transportation services are also receiving curbside service to their homes. We're asking families to come to the bus when the bus arrives to be able to pick up those breakfast and lunches so that we can keep our buses on route and on time for those deliveries. We will continue to adjust these services to match utilization and need. So we may be adding hubs or moving some of those hubs if they're not being utilized so that we can get our services to where they're being utilized the most. The other thing is the child care services are being provided to Tier 1 healthcare and emergency response providers at this time. That's happening at all of our elementary schools. We have a great deal of thanks for the Duluth YMCA, who is helping to coordinate those efforts. As well as the lunch adjustments that we're making, we will continue to look at our child care services that we're providing and adjust based on utilization and need as we move forward. Our focus for the rest of this week and into next week is on designing an equitable, accessible system of distance learning should a longer closure be necessary for our schools. Our staff is hard at work connecting with each other and planning for how we will connect with our students should that closure become necessary. We appreciate all of the support of community organizations and individuals who have been reaching out, offering their help and assistance as we work through these details. Please be watching our website for more information. We're also providing information through any other means that we have possible, through social media, emails, our Infinite Campus accounts. So please be watching for more information to be coming soon. We expect an announcement sometime, either late this week or next week, on what the future may hold. We do not have any information on a longer closure at this time. Thank you.
Good morning, and thank you again, Mayor Larson, for once again bringing us all together for this frequent messaging. I'd like to start by saying how appreciative I am in working with St. Luke's. You know, we've come together to share best practices and ideas and supplies and whatever for the good of the community. And so CEO Kevin Nokels, thank you and all your leaders for this great collaboration that's been for the benefit of the community. I'd also like to say how appreciative I am of our healthcare workers. I mean, they, from the front line up to the leadership, they have really stepped up. They've been courageous. They've been thinking of others before themselves, and it is truly inspiring to me. My name, by the way, is John Pryor, and I'm the president of Essentia's Health East Market. I'd like to start by acknowledging the terrific work being done by so many people in our community, actually. We realize that we are all making a huge request, you've heard it multiple times today, to stay home. That is a big sacrifice. It's hard to cancel events, to miss concerts, games, to avoid eating out, to socially distant yourselves, but is so vitally important during these unprecedented times. It will help us limit the spread of this virus and mitigate its damage. At Essentia Health, we continue to plan and prepare for COVID-19. We've taken several steps in recent days aimed at protecting our patients, staff, and communities. For example, we're temporarily discontinuing elective procedures and routine appointments. Also, we have implemented visitor restrictions. These are difficult, gut-wrenching decisions, but necessary ones. With a shortage of testing supplies nationwide, we really want to emphasize our free e-visits for COVID-19 patients. This is the best way for us to screen patients and determine if additional treatment is required. You also can call our hotline at 1-833-494-0836. Again, 1-833-494-0836. This way we can look for some of those telltale symptoms, shortness of breath, fever, and cough, and known exposure to COVID-19 and/or travel to affected areas. A couple days ago, I filmed a public service announcement with Mayor Larson and others from St. Louis County and St. Luke's, and I really like the theme that we promoted, which was, together we can get through this. Thank you.
Good morning. I'm Kevin Nokels, President and CEO of St. Luke's. Thank you, Dr. Pryor. We greatly appreciate the collaboration, cooperation of working with Essentia Health and truly all the partners. We are most appreciative of the entire community for recognizing and honoring our expectation around our reduced visitors policy, elimination of some elective surgeries and routine office visits. That takes an entire community. I'd also like to assure you that working together, we have significant preparedness efforts underway, not only at St. Luke's, but every hospital across the state of Minnesota. It's something we do very well. We are connecting not only with local and state and national resources, but across the state as well. We are sharing ideas, best practices, developing policies, plans, and contingency plans, as together we are looking to understand and address how do we address our staffing, space, supplies, testing, and other logistical needs that we will have for managing a potential surge of patients. Now, I'll give you an example of that. There's an assessment that goes on every day looking at the availability of hospital beds, supplies, staffing that gets updated daily. There's frequent, regular calls. So we are very blessed and fortunate to have an outstanding healthcare system in our region. Again, I'd just like to thank everyone. Thank you, Mayor Larson, for hosting this unified media briefing. Thank you.
Good morning. I'm Holly Sampson, President and CEO of the Duluth Superior Area Community Foundation. I want to thank all of you for joining us today, and thank you to Mayor Larson for this really excellent community presentation. So I'm really here to be ambassador for our amazing nonprofit organizations across this community. Just this Tuesday, we hosted a meeting with the major funding partners that are based in Duluth. That included the Ordine Foundation, the Northland Foundation, the Lloyd K. Johnson Foundation, the Community Foundation, and the Head of the Lakes United Way. We are all extremely concerned about the impact that this crisis is having and will have on all of our nonprofit organizations. We're concerned about revenue streams that will decline significantly because of the cancellation of events, fundraising events, and activities that is a tremendous source of revenue for these vital nonprofit organizations. We're also, of course, very concerned, as you know, nonprofit organizations rely on a base of volunteer support, and that volunteer support is diminishing as well. We're concerned about the staff that work on the front lines every day to support all sectors of our community. And just like the healthcare institutions, they will be vulnerable as they work with residents across our communities. So again, the 5 major funding organizations have come together to create a new financial resource. It is a fund that is hosted now at the Community Foundation called the COVID-19 Response Fund. This is a collaboration, again, with the Northland Foundation, the Ordine Foundation, the Lloyd K. Johnson Foundation, and the Head of the Lakes United Way. We will be working together extremely closely. We will be meeting on a weekly basis to assess needs and really distribute dollars that we want to raise in the community. So we are so fortunate to live in a community that is so generous, both in its volunteer capacity and in its giving financially. And so we want to encourage individuals and families and businesses to support the COVID-19 Response Fund. If you go to dsacommunityfoundation.org or .com, make it as easy as possible, you can see more information about the COVID Response Fund. I'm happy to report that before we even announced it, we already had a gift this morning online. So we encourage people to make gifts. People can send in checks as well, but we would certainly encourage online giving. So this is an amazing community that we all get to enjoy. We really want to see the community step forward to support our nonprofit organizations who work so closely, especially with our vulnerable citizens. So thank you so much, and I'm happy to answer any questions after we're all completed. So thanks for being here.
Good morning. My name is Angela Engblom, and I'm here representing Memorial Blood Centers, which is our local community blood supplier. We are the sole supplier of blood to over 30 hospitals, including Essentia and St. Luke's, which you heard from earlier, and nearly all of the blood that we collect in the Northland supports our patients right here in our own community. My key message is to remind you that a stable supply of blood is needed for our hospitals and for our critical component of emergency preparedness, and we are asking for your support to make sure that we have that continuous supply to be able to support the hospitals. Memorial Blood Centers has an urgent need for healthy blood donors to help strengthen our community blood supply. Many of the local blood drives and across the country as well have been canceled due to the COVID-19, and more people are choosing to stay home instead of coming out to give blood. It's important to know that giving blood is safe. Donor centers and blood drives are places where healthy people can make life-saving donations for patients that are in need. As always, in order to be eligible to donate blood, you must be free from any cold or flu-like symptoms for at least 3 days. We also take every donor's temperature prior to donation, and anyone who feels unwell is ineligible to donate blood. In order to further protect our staff and donors, Memorial Blood Centers is asking for donors to self-evaluate before coming in to donate. Please do not present to donate if you have any of the following criteria: if you have a fever or other symptoms of COVID-19, if you've had close contact with someone diagnosed with or suspected of having COVID-19 in the last 14 days, if you've traveled to a level 3 country as defined by the Centers for Disease Control in the last 14 days, or if you've been diagnosed with or suspected of having COVID until 28 days after your illness has resolved. Visit Memorial Blood Center or mbc.org for more information on our deferral policy. And furthermore, Memorial Blood Centers has implemented additional screening questions and rigorous cleaning precautions to keep our staff and our donors safe. We are practicing social distancing as most other places are, and we are cleaning our donor beds in between donor visits. We're spacing out appointments, and we're also spacing out our donor beds and encouraging donors to wait in their car until their appointment time instead of waiting in our waiting area. We're also collaborating with our hospital partners like Essentia and St. Luke's to conserve blood when possible. As St. Luke's and Essentia mentioned earlier, they are postponing elective procedures, which will assist us in maintaining a stable blood supply. And as a reminder, a stable supply of donated blood for hospitals is a critical component of emergency preparedness. If you're at home and you're feeling healthy and looking for a safe way to get out and give back, please give blood. Visit mbc.org, or you can call us at 888-448-3253 with any questions or concerns. Thank you.
So that's a lot of information. I want to thank all of you who have tuned in, who are watching and tracking all the information. We will take questions, but in summary, I do want to say we will be sending out a press release around the sales tax, tourism tax collection, and the deferment of those that will be sent out. Look for more information coming out about city services. And for people at home who are feeling like you don't know what to do and you're feeling disconnected, I hear you. I want you to know that we do see you. We are working so hard to reach you in all of the ways to let you know that you matter and that we're doing all of this for you and that we all have a part of taking care of each other and taking responsibility. You can give blood, you can donate to this new fund, you can support your local economy, and you can also stay home and take care of each other. So this is on all of us now, and I want to assure you the City of Duluth continues to be open. We continue to serve your needs. We continue to show up when you need us, just as every single one of these organizations do, and we will get through this.